Before you panic about a low platelet count, stop and think. My name is Leah. I've been an ICU nurse for 19 years, and today we're talking about the Pause and Think Lab platelets. So when I see a low platelet count, here's some things that I think through before I talk to my provider. First, how low is the platelet count? Has this been a sudden drop or has it been a gradual drop? Then I start thinking through the why. Is the patient on CRT? Is the patient on heparin? Are they septic? Are they getting a ton of blood products? Then I think about the patient assessment that I might want to report on. Does this patient have bleeding from their gums? Is there bleeding in their NG or OG tube? What about bleeding around their surgical sites, bleeding from any tubes that they have, from their urinary catheter? I'm also thinking through any medications that they're on that could be contributing to this. I also like to think through what kind of procedures my patient may have that day. Does anyone need to be notified of this besides just my attending in case they need to put off or do some things before they can do a procedure? So I like to gather all of that information before I notify my provider so I can give them the whole picture. And don't forget with platelets that if the platelet patient is receiving heparin and their count has dropped by 50%, even if they're technically still within the normal range, that should make you think this could be a hit situation, and you would definitely want to notify your provider of that. This is how I teach new ICU nurses to think through labs instead of just reacting to one number. If you want to build that kind of bedside ICU critical thinking, you can check the link in my bio and join us in the ICU Success Academy.